name is Angelos Halaris. My current title is Professor of Psychiatry and Chair Emeritus in the Department of Psychiatry at Loyola University Chicago and Loyola University Medical Center. What puzzled me, fascinated me, was human behavior. I was hard-pressed to understand why people can be almost on the opposite ends of a spectrum of goodness versus vice and badness. People can be loving, caring, compassionate, but they can also be vicious, angry, even criminal. So the spectrum of human behavior puzzled me when I was coming into my teenage years and throughout my teenage years. I also had exposure through a classmate of mine whose father was a psychoanalyst during my high school years. So I heard about Sigmund Freud and other later psychiatrists worldwide. I was fascinated by, I didn't read them obviously all, but the key ideas that I kind of heard about, read about, summary forms, fascinated me. And I thought, well, maybe that's what I should do. I decided to go into medicine because I had to go into medicine to become a psychiatrist. And that's what I did. And I have not had any regrets ever since. I have been very interested and committed to biological aspects of human behavior and human disease, psychiatric disease, mental illness, mental dysfunction, the whole spectrum of mental illness, which is very broad and multifaceted. But more specifically, I was interested in the possible causes, which can be biological in nature, but also non-biological and even genetic. So I zeroed in on psychopharmacology, the use of medications to help people with mental health issues. And psychopharmacology has been basically the cornerstone of my work, my research from the beginning to the present day. But not only psychopharmacology, I have dealt with biochemistry, neurochemistry, how the brain functions, what kind of substances that are found in the brain can be aberrant, can be wrong, not enough, too much perhaps sometimes, and how can these deficiencies, possibly to some degree determined genetically, be corrected with medications. That remains my interest, but I have also, in the past 10 years or so, gotten more into the immune system and the interface between immunology and psychiatry, and taking that a step further into the genetics of the immune system and by extension the genetics of people with mental illness. So it's the combination of all of these, but not to the exclusion of utilizing non-pharmacologic approaches to help people who have a mental health issue. We refer to as psychotherapy, talk therapy, and I still practice that to this day. I'm also a teacher. I like to teach, so one area that I have a strong commitment to, and actually I'm told I'm doing a pretty good job, is to teach. And I've been teaching medical students, still do, and trainees who, we call them residents, who have completed medical school and are trying to become psychiatrists. We call this the residency training program. I have dealt with both medical students and psychiatric residents throughout my career, and I still do that. I enjoy that. I think that's a contribution, and I try to teach the young physicians, aspiring physicians, basically what I think of psychiatry, and hopefully they will see my viewpoint and maybe follow it or not. That's one area. In the area of research, I have done a lot of research in the areas that I mentioned earlier, and I still do. I think some of the contributions that my research has made is to unravel what we call now biomarkers of conditions, psychiatric conditions, focusing on depression, depressive illness, which is a major illness that afflicts anywhere from 10 to 15, even 20% of the population worldwide. So we need to understand these conditions. We need to see what is wrong, what causes them, how much is genetics, how much is the environment, how much does early life experiences from day one after birth and even before birth can predispose the individual to develop mental health issues at any point later in life. I know what it's like to have a mental illness. It can be very, very hard on the person, all the way to the point of wanting to take their lives because they can't tolerate the pain, the suffering. So helping these people regain interest in life and have a better life is the most rewarding aspect of what I'm doing. Almost right up there is the satisfaction from teaching young colleagues, aspiring psychiatrists, and also working with colleagues of mine who are junior to me and helping them build a career and possibly share my point of view about psychiatry and how important it is to help our fellow human beings who are troubled with a psychiatric condition. I feel I have the fortune and the privilege to have made it to the point where I am career-wise, and I think I also have an obligation to pay back. And paying back is by helping other people who are struggling with mental health issues, helping them regain perhaps their entire life, or at least have a better life by treating them correctly, having therapy done either myself or other specialists, depending on the need of the individual. But also I give back by teaching. So patient care and teaching are, in my view, the ways I give back to our fellow human beings. One experience that I really would like to hone in on is the experience I had when I was invited to join the Department of Psychiatry at the University of Chicago, here in Chicago, many years ago, a few decades ago. And the department that I saw as a trainee initially was absolutely fascinating. I like to say, when I got there and saw what people were doing and what kind of a department the chairman of the department had assembled, I felt like I was Alice in Wonderland. that I had gone to sleep and woken up and found myself in paradise. That's how it felt to me. And I'm not exaggerating. That department was absolutely stellar. A model department, which I thought to myself, well, maybe I'll be able to do something like myself. And that opportunity arose years later when I was offered a position to chair the Department of Psychiatry at the University of Mississippi in Jackson, Mississippi, which I did. And that was another extremely rewarding experience that I had, because I was able to accomplish a goal that I had set for myself. And my goal was modeled, patterned after the model I had experienced at the University of Chicago in this city. It was one experience that was, I wouldn't say life-changing. That was life-changing for me, both personally and professionally. Another experience was the relatively recent COVID pandemic. What I witnessed, and not just me, but is the tremendous increase in mental health issues. By many statistics, the statistics have been skyrocketing as far as people with serious illnesses, reactivation of pre-existing illnesses, to the point where all the available providers were overwhelmed by the degree of... So that gave me a lot of issues to think about. These were not people who had COVID. Some did, but not everybody. But the issue of stress, life stress, anxiety related to life circumstances, fear, and certainly not last but certainly not least, social isolation. These are factors that I and others have looked at and looked into, and rightfully so, and said, oh, we've learned lessons here. Social isolation, if imposed upon the individual, can cause a lot of problems. Stress, obviously, can be very damaging. So teaching everybody, especially our young colleagues, to be mindful of stress and teach our patients how to cope with stress, how to develop stress resilience, in my view, are major, major issues that we need to look at very, very seriously, both in the medical profession, but in educating children, starting with elementary school and high school and college. Stress is a major factor in life, and we need to not just talk about it, but really do what's right to do by teaching our fellow human beings how to manage and cope with stress more successfully, because stress can kill us. I am getting up there age-wise, so retirement is not too far away anymore. Eventually that's going to happen. It's not happening right now. I don't have any immediate plans, but for now I plan to continue doing what I'm doing, basically seeing patients, which I do every week, teaching my students every week, and also publishing, writing review articles, original research articles, and giving presentations at national and international meetings of psychiatric content. Well, outside of work endeavors, a couple of things come to mind. I like to travel. I like to see the world. I have been interested in doing this since I remember. And I have had the opportunity to combine traveled to many parts of the world, almost all continents I have visited, in conjunction with international scientific conferences and congresses. So that has given me the opportunity to see the world, see other people in general, how they live, how they behave, how they manage their lives, but at the same time meet colleagues and see how they work, how they practice, how they do their research, and that has been extremely rewarding for me. So travel has been an interest in combination with my profession. The pandemic is the historical event of recent memory, as I just expanded on, that I see as a major historical event that we still have a lot to learn about and take proper action just in case it happens again, and it may. It may not be COVID or another infective agent. It can be a war, a disaster, climate change especially, natural disasters. We need to teach ourselves and our younger human beings how to cope more effectively with stress. Because I think we are in, as a world, for more surprises. Just like COVID came out of nowhere, there's nothing to reassure us that something like COVID will never ever happen again. More likely than not, it will. We had 100 years ago, we had a similar outbreak of a viral infection that wreaked havoc in the world, much like COVID did. There's no guarantee that something like that is not happening again. It may not be 100 years from now, it may be a lot sooner. So we need to gear up and be prepared to meet the challenges of the world we live in and factors and conditions that are outside of our control, such as, well, not outside of our control. Climate change is something we can do a lot about, but we've got to get going seriously, not just talking about it.